How can studying a population like refugees help us to reframe non-communicable disease care and promote health equity when considering that health is viewed as a commodity rather than a human right in the United States? Well, my name is Rola, and I am a senior in the Global Health Honors Capstone, and my research focuses on the social and structural barriers to refugee health and health equity in the United States. Data on NCD prevalence among arriving and post-resettled refugees is missing. Therefore, policies towards refugee health focus more on infectious disease rather than NCDs, leading to a cycle of neglecting NCD care and poor health outcomes. I argue that the US should focus more on NCDs for refugees because through neglect and multiple social and structural barriers, refugees face a higher burden of disease, creating gaps in equity in the healthcare system. By analyzing the diagram on the right, we can illustrate this phenomenon in a cyclical nature. So my findings show that the lack of social and economic mobility, for example, low socioeconomic status, such as education, income, and occupation, and a low-paying job, lead to a lack of money to afford quality healthcare resources. This, combined with a lack of focus on NCDs through social barriers such as language or religious beliefs, and structural barriers such as gaps in healthcare coverage, lead to poor health outcomes, such as hypertension, diabetes, and obesity, all of which are non-communicable diseases. Thus, we cannot achieve high social and economic mobility because your health hinders your ability to perform well enough for the demands of the job. One significant example of a social barrier is that refugees from the Middle East often have an Islamic background, which dictates the importance of same-sex healthcare. This can be an issue when there are no female providers available, which often delays the treatment process. Obstacles for NCD prevention and treatment, such as this one, hinder good health outcomes for refugee populations. Therefore, the next steps for equitable refugee health need to include healthcare and refugee health policy reform by shifting the focus from infectious disease to preventing and treating NCDs and increasing access to quality healthcare resources. My research brings us one step closer to promoting broad health equity by addressing NCD care for refugees through improving access to healthcare resources in the United States while addressing healthcare disparities to reduce the global burden of disease. Thank you.